We continue our team coverage of the nursing home crisis. The Governor Cuomo responding today to the criticism over the crisis, and our Capitol correspondent Karina Capabianca has more on what he had to say about calls for that federal probe.
Much of the controversy is over a state order that allowed COVID-positive patients back into nursing homes. It's since been modified, but the governor said that he was following CDC guidelines at the time.
The state followed President Trump's CDC's guidance. Okay, that's that answer.
That was the governor's response when he was asked why the state issued an order in March allowing patients with COVID back into nursing homes. The governor says that CDC guidance said nursing homes should not be allowed to discriminate against a patient with the coronavirus. He said a big issue in March was hospital capacity, and he says nursing homes shouldn't accept patients they're not qualified to handle.
For a COVID patient, a nursing home must say, I can quarantine, I can isolate, I have the right staff, I have the right PPE, or else that nursing home should not take that patient.
Earlier this month, the state changed its policy, saying that now hospitals can't release a patient back to a nursing home unless that person tests negative for COVID. Nursing home deaths have accounted for roughly a quarter of COVID deaths in the state. Congresswoman Elise Stefanik and other upstate representatives called for a federal probe into the issue during last night's congressional town hall.
I do think it's important to have an independent investigation to provide answers to those families who have lost loved ones and are truly heartbroken.
If the federal government wants to start a probe, then they can start a probe.
Currently, visitors are still barred from coming into nursing homes except for end-of-life visits. Reporting in Albany, Karina Capabianca.